compliments of the new year, ladies and gentlemen. I hope I find you well in this new year 2026. And I must say, thank you for tuning in to Dr. Truth's podcast. It is the one, the only, the international, the host, Tinaishe Mhlanga, a.k.a. Dr. Truth. Ladies and gentlemen, before we can go further, I just want to extend my gratitude to all our viewers for the views, the likes, and the comments. And I just want to say, if you are new onto the channel, please be sure to subscribe. So ladies and gentlemen, today we are going to be discussing something topical, something important, and something that we just cannot ignore. But before we can do that, allow me to tell you a bit about our partners for this particular episode. So this episode is probably brought to you by Pod Media, together with Look East China Shoppers. So if you are out there and are thinking of purchasing stuff or shipping stuff from China, Look East China Shoppers is the one-stop shop to have all this done for you. So if you're looking for convenience and the best of service, Look East China Shoppers is the place to go, whether it's heavy duty machinery or clothing, fabrics, and stuff like that. Look East China Shoppers is the place to go. So ladies and gentlemen, today we will be discussing cervical cancer. So we know from statistics that women have the best health-seeking behavior in comparison to men. However, a significant number of women die due to this disease, cervical cancer. So ladies and gentlemen, I think it is indeed a topic worth discussing. So today, as I mentioned earlier, we are going to be discussing cervical cancer and breaking it down so that we ensure that in the future we have, lower incidences and ultimately lower mortalities. I am glad to be saying that for this particular episode, I will be discussing this topic with a good friend of mine with whom we are going to be delving deep and sharing insights on this interesting topic. Pleasure to be having you today, Miriam. I have to say, we've been planning for quite some time, and finally, after a long while, we are here.
Absolutely.
Just give an introduction to our viewers before we can proceed.
Thank you, Dr. Truth. It's a pleasure to be here. My name is Miriam Gunda. I'm a fifth-year medical student, and I am a strong advocate for women's health as well as just health in general.
Right. Thank you so much, Miriam, for coming through and accepting the invite. So we know that yesterday, the 4th, was being commemorated as World Cancer Day. So this discussion, therefore, comes in very important discussion, considering all the numbers and all the the information that we're yet to share in this particular episode. But maybe just to lay a foundation before we can go further, why is this subject worth talking about in the first place? What are those things that at this point are pushing us to be discussing about cervical cancer?
Well, cervical cancer is actually the #1 leading women's cancer in Zimbabwe, and yet it is one of the most preventable and one of the most curable cancers that there is. Every year there are 3,000 new diagnoses, and then as well as roughly 2,000 deaths due to cervical cancer per year, and yet it can be cured and prevented. So I think it is very important for us to teach the public, the general population, so that we can drastically reduce these numbers to a much more favorable rate. Because in the developed world, cervical cancer in some countries has actually become something to be heard about from other places because of the success of how much they've reduced it due to the awareness and all of the screening and strategies they've done.
Okay.
Yeah.
All right. Thank you so much. So to our viewers back at home, I'm going to say this. You better take out your notebook and your pen, because we are about to dish out some information. So thank you so much for, highlighting the importance of this particular discussion. But probably there's someone back at home who at this point doesn't know what cervical cancer is. Nechishona chikuti gomarara remuromo wechibereko. I got my Shona right?
You got
exactly.
it right.
So maybe to the viewer back at home who is not well versed with what cervical cancer is, just give us an insight of what cervical cancer is.
Cervical cancer is basically abnormal growth of the cells of the cervix being the opening to the uterus. Um, so naturally in our bodies, all the cells everywhere, they have a component that tells them when to grow and when to die.
Okay.
So our bodies live in balance. The cells are balanced. While some are dying, new ones are being made. So now what happens in cervical cancer is that due to the HPV virus, it's human papillomavirus, when it infects the cervix, it then causes change in the DNA of the cells. So now when it was supposed to grow up to a certain stage and then die, these mechanisms make it continue to grow, and then the ones that have been told that are usually supposed to tell the cells when to stop growing, these ones are now dysfunctional. They don't work anymore. So these cells just continue to grow and grow and grow, and they don't die at all. So that is how we end up having cancer in the cervix.
Okay, right. Vabereki kumba, I believe you've taken note of chimbori chii chinonzi gomarara remuromo wechibereko. What is cervical cancer? Thank you so much, Miriam, for that concise description of what cervical cancer is. So now we want to understand, because people have their pre-made conceptions pertaining to, conditions or this and that, right? It may be because of the socialization that we've had, or from, the communities that we come from, or some may actually be religious constructs, that pertain to certain conditions. So maybe can you enlighten us in that regard? Kuti, are there such myths and misconceptions pertaining to cervical cancer?
There definitely are. As you said, people generally tell each other things, and then they believe each other. So one of the first ones and most important ones is people thinking that only promiscuous women get cervical cancer. But that is not true. Cervical cancer comes from persistent infection with the HPV virus. So it can actually just have come from your one sexual partner. Even if you've had one partner your whole life, he can be the one who has it, because men generally are silent carriers. So then when you contract the virus and your body fails to eliminate it, then this infection persists for many years, and that eventually leads to the cancer.
Okay.
And then another one is that only girls are affected, so only they should be vaccinated. But as mentioned before, the men are silent carriers, usually, not all the time.
Okay.
They actually can get sick from the HPV virus. So if we can vaccinate both the men and the females, our numbers would reduce a lot more significantly than if we're just vaccinating the girls only, because now we don't have these people that infect the females. And then people also believe that if they're not feeling sick, if they feel fine, then that means that they don't have cancer and they've got no reason to get screened.
Okay.
But that is also not true, because what happens in cancer, in cervical cancer, is that initially there are no symptoms at all. You notice nothing, you feel nothing. And also the reason we screen is so that we can catch it before it becomes cancer. So when you've had this HPV virus infection, what it then does is it changes the DNA of the cells, but then it takes many years to change. And initially you have this change that is not cancer yet. So it progresses from something mild to a bit more severe until it becomes cancer. So what we try to do with screening is to catch it before it becomes the cancer, when it's still in the mild or moderate stages of the changes of your cells of the cervix. And then the other misconception or myth is that when you get cancer, you can get treated by, herbs out there and all sorts of other
Non-conventional.
non-conventional means. And as much as they may help with the symptoms, because we do understand that herbs are also medicine, what you do really need to do is visit your doctor, visit your gynecologist, and then they will assist you.
Right. Thank you so much. Quite some deep insights there coming from our guest Miriam Gunda. Thank you once again. Still on the myths and the misconceptions, I always get to say this whenever I get the chance. Just because you are a person of faith, it doesn't mean you can't go and look for assistance from medical practitioners.
That's true.
It's not an act of lack of faith. Right? I want to reinforce that medicine and faith, they are not at loggerheads. You go into history and you find people that were used by God in their medical practice, right? So it's not a lack of faith. It's not to say maybe you are now deviating from the faith and stuff like that, which then goes to all our viewers at home to say, do not think that just because you are a person of faith, you're not going to seek medical assistance. We encourage you to. And I'm going to reinforce, we encourage you to seek medical assistance. So you already preempted screening and stuff like that, which you're going to delve into a little later on. But yes, tiri kuti kudzimba uko, kuti une chitendero chako, hazvisi kureva kuti wakurambidzwa kunobatsirwa kuchipatara. Vana chiremba vanotoshandiswawo naJehovha kuti vange vachiita kuti utano hwedu hunge huri nani. Handiti ndizvo? So thank you so much once again. So as we proceed, we know that there are risk factors or predisposing factors that, with continued with those risk factors, with continued exposure to those risk factors, this individual is likely to develop cervical cancer. So what are those things that put someone in a position where the cervical cancer can proliferate to an extent equity the immune system cannot eliminate it?
All right. So I think first we can probably discuss what leads to you acquiring cervical cancer. So as mentioned before, it is persistent infection with HPV virus. So for you to have persistent infection, it is either you have continued exposure to the virus, or you got the virus and your body had reduced ability to fight this infection. Pachona tiri kuti masoja emuviri atadza kurwisa virus rinonzi HPV. So the first risk factors are what causes you to have increased exposure to the virus. So this includes early sexual debut, which is kukasika kusangana nemurume uchiri zera rechidiki, especially younger teenagers. So zvinoita kuti unge uine makore akati wandei exposed to HPV. And then kuva partners akawanda epabonde. Having multiple sexual partners, again, you are exposed. Maybe your one partner didn't have, but then now there's these other three who have, and they're constantly exposing you to it. That also puts you at a higher risk. And then now, when you have reduced ability to fight the virus, this can occur in any reason to have immunocompetence. And for us in this setting, it is mostly HIV. Those are one of that is actually like the leading cause for someone to be at high risk for contracting HPV. Another one is having diabetes or hypertension, or being on any drugs that may reduce your immunity. And then also having reduced access to screening. Maybe you're living in remote areas, or you have no knowledge of it. And that is the purpose of having these campaigns and this talk so that maybe you can reach more people. As you all know, we had cervical cancer month in January. So it's very important that we bring more awareness to people. And another risk factor as well is just having poor access to healthcare in general.
Yes.
Okay, all right. And being exposed to high risk HPV types. So the virus has different types. We have low risk types. There are which are HPV 6 and 11. So these ones are the ones that then lead to you getting genital warts.
Okay.
And then the high risk ones, we have HPV 16 and 18. Those are the most common ones, and they're the ones that we do end up vaccinating against. And these ones are the ones that can lead to cancer. So being exposed to these types of HPV increase your risk of getting the cancer.
Okay.
Yes.
Okay. Right. Quite some nuggets coming from our guest there. Thank you so much for sharing those risks. So, if there is any risk factor that you are able to avoid or run away from, please run. Okay. And I actually forgot to comment on when you're talking about the myths. People, in hospital settings or maybe in the community, they'll just have this notion, probably they were vaipinda-pinda and stuff like that. But thank you for highlighting that it's not a matter of kupinda-pinda and stuff like that. We are saying that people can actually just be carriers and not even have like the manifestation of the HPV as cervical cancer, right? And maybe the spouse is the one who is the carrier. Not to even say the spouse was also pinda, but because microorganisms are ubiquitous,
Yes.
right? So you just never know, right? Thank you so much. So before we can proceed, allow me to once again share about our next partner, which is Swift Errands. So maybe you're out there abroad, South Africa, United Kingdom, Dubai, and you have some important errands that you need done for you, whether it's purchasing of stuff, for maybe Wana Gogo and Nana Sekuru who are here, or you have a building project somewhere and you need trusted stewards that are going to do this task for you. Swift Errands is your one-stop shop, which is going to deliver on the go. So contact Swift Errands if you want a good job done on whatever task you want. Now, back to the topic, cervical cancer. So, what is the presentation of cervical cancer? Chii chinozokonzeresa kuti o chii chingaonekwa nemunhu chinozoita kuti akasire kuenda kuchipatara? What are those, subtle findings that should prompt me, or should prompt a woman to go to the clinic?
Well, I will talk about these symptoms that present stage by stage. So initially with cervical cancer, there are no symptoms. You will have no changes, you'll feel fine. And that is usually the point where it is still quite small and we can manage it much quicker and much easier. Again, I take this opportunity to stress the importance of screening while you're still fine. And then as it grows and progresses a little bit more, you start getting some abnormal bleeding. So what happens is you can start bleeding in between your menstrual period, kubleeda pakati pemazuva ekumwedzi ekutera. Kana kuti you can bleed after sex, which is bleeding after intercourse, kana kubleeda mushure mekunge wasangana nemurume. And then another one is unenge wapedza kuenda kutera nekuda kwezera. So this is menopause. And if you start bleeding after you've had your menopause, that is also a significant symptom of cervical cancer.
Okay.
And then as we also progress, you also get discharge. Unotanga kubuda mvura dzekuzasi dzakati wandei.
Okay.
Dzinenge dzichinhuwa. It's foul smelling discharge. It's very strong, the smell. And then as we progress further and further, you start experiencing pain. You have some pain in the lower region in your pelvis, and you can have pain during intercourse now. And then in the more advanced stages now, because this mass is getting bigger and it's starting to occupy space, the pelvis is a very small region and everything is next to each other. The mass starts to invade some other tissues. So you can have back pain or leg pain. That'll be caused by the mass invading the nerves that innervate our legs. Nerves anobatsira makumbo nemusana kuti zvishande. Unotanga kurwadziwa musana nemakumbo iwayo. Unogona kurwadziwa nekuita weti kana kuti weti inobuda neropa kana kutongonetsekana nekuita weti yacho. So this is because the mass now it can be invading the tubes that bring urine from the kidneys to the bladder. Kana kuto invade bladder racho.
Okay.
And then for the general system, muviri wako wese unotanga kunzwa kuneta, kuita fever, kutanga kudziya muviri kana kupindwa nechando, excessive sweating, nekuwonda zvisinganzwisisike.
Okay.
And also because you're now bleeding more, you get symptoms of anemia, which is kupera simba, kunzwa dzungu, kutemwa nemusoro,
palpitations.
Yeah, hana inenge ichirova, having palpitations. Thank you, doc.
All right.
Yeah.
And appetite? Any?
Inodzika.
All right.
It's one of those symptoms that affect the whole system.
All right. All right. Thank you so much. Sakavabereki, viewers back at home. What we are saying is na Miriam, what Miriam has just shared with us. Whenever you see that, I'm probably noticing this, I'm probably noticing that, we are requesting you, by the mercies of God, just go to the clinic, go to a doctor and just find out. It's better to find out. I know it's nothing to worry about, right? So that we cut down on the incidences and ultimately the mortalities due to cervical cancer. So, Miriam, we have a problem in our African health system. Coming closer home, in Zimbabwe, there is a strong pattern of delay in presentation. It's prevalent. People will come very late. People will come at their own time. Someone will say, okay, not particularly for cervical cancer, but in any type of, someone will see a mass, right, that they don't understand, that will persist and start to produce a discharge. Then they will go and it starts bleeding or something like that, right? So in this regard, particularly pertaining to cervical cancer, what are the implications of late presentations? How bad can it get? And what just can you say in view of late presentation?
Well, late presentation will affect the patient in so many ways. First of all, treatment becomes a lot more difficult. So we said when it's small, right, it's easy and it's cheap and it's quick. When the mass is still very small in its early stages, we just take the patient to surgery, to theater, and we operate on it. We just remove it, and then they can recover a lot quicker. But now, as it gets bigger, you start having to include other treatment mechanisms like radiotherapy, chemotherapy. And with chemo, you've got so many cycles that you constantly have to keep coming back for. It has many side effects. It's a lot more expensive. So now the patient is suffering from just the anxiety of wondering if they're going to get better and how much time on their hands they're spending under this strenuous treatment, as well as just so much money that they are now spending. And it's also a financial burden on the country itself. And then there's reduced quality of life. They have pain, they have that fatigue, those symptoms that we talked about, having systemic symptoms, all of that. And chemotherapy makes those symptoms even worse.
Okay.
And then the risk of mortality, the risk of dying from this disease increases drastically.
Okay.
And yeah, so the prognosis is very poor when they present late. Kind of shitty prognosis. The word pro means good. So the possibility of a good outcome is very, very much reduced.
Okay. Interesting. Well, not interesting in the sense, but quite disheartening, because you go into our local hospitals and that is what you're going to see. People are coming late. People are coming when the doctors can just do the bare minimum.
Yeah, and what's really hurtful about this is that cervical cancer is very preventable, so preventable, and very curable, especially in the early stages. You can cure it and it will never come back.
Okay.
So it's so painful to see people dying from something that can easily be avoided.
Yeah. All right. Thank you so much. Thank you so much once again, Miriam. So as we go on, we want to find out what are the treatment modalities that are available to, alleviate, the negative outcomes of cervical cancer, right? What can be done at the very earliest stage? What systems can be put in place, or what systems are already in place to make sure that we curb, cervical cancer?
All right, well, there's a 4-part strategy in controlling cervical cancer. So the first part is primary prevention, which is where we vaccinate our children. Some texts say girls, but as mentioned before now,
men can be carriers.
Yes. So our children from 10 years up to around 15 years, we want to vaccinate them before they have had their sexual debut.
Okay.
And then we also educate the public. We raise awareness and teach them on how to have safe sex practices, the use of condoms, to reduce just generally sexually transmitted infections in general, because when you're exposed to one sexually transmitted infection, it actually does increase your risk of getting the HPV as well.
Okay.
And then the second part is secondary prevention. So that is now when we are screening the sexually active women who are at kind of an increased risk of acquiring this infection. So in our country, we start at, should be between 25 and 30 years. It's probably younger in the private sector, but in the public sector, we start screening 30-year-old women and above. So then the high-risk women, the ones who have HIV infection and any other increased risk of contracting the HPV, we start screening earlier, and they have to come every year. But then these lower risk women, they come every 3 years, 3 to 5 years for pap smears or the HPV DNA test. And then in the lower resource settings, we do what we call a VIAC. It's a visual inspection of this cervix using acetic acid. And that is actually the one that is mostly used in our more remote areas, as well as the government hospitals. And this screening is done for free, actually, in public hospitals. So, our central hospitals like Parinyatwa, Harare Hospital, as well as any of the government hospitals out there. And then the third stage is, so when we were screening, in the second stage, we're trying to catch the, what is it?
Pre-malignant lesions?
Yes, those ones. We're trying to catch the lesions before they become cancer, but while they're still changing, while the cells of the cervix are still changing. And then we can treat those a lot quicker before they evolve to become cancer. And then the third stage is, catching the cancer when it is still a lot smaller.
Okay.
And it's easier to treat. So when the cancer is small, in the very, very early stages, we cut it out, and then it's gone. And then when it becomes advanced to the stage that we cannot treat it, then we would just have to use palliative care. Unfortunately, in this case, that means we are trying to improve the patient's quality of life when there is nothing else we can do to treat the cancer, but just to make them more comfortable, put them in less pain, reduce the symptoms in their end of days. In their last days, in their final days. Yes.
And it's really difficult, because that just becomes, having to say, okay, there is nothing that can be done, when probably hits a little harder when you've been, in a space like that.
Yes.
But, also you as medical students, you're in that space, and, every now and then, the doctors are like, Babereki, at this point, there isn't much that can be done. All we can do is to help, alleviate the symptoms and things like that, which then goes on to say to our viewers back at home, anything suspicious, please consult, look for help, inquire, muzive kuti pane zviri kunetsa here, zvakamira sei. So you mentioned that men are carriers, right? Earlier on. So maybe we just briefly, as we are drawing to a close, we want to talk about the HPV in men, probably what can happen to men, persistent infection with HPV, and what is the role of circumcision?
All right. Well, men can actually be affected by HPV infection. So there are the low risk and the high risk HPV types. The low risk types will also cause genital warts in men. And then the high risk types can lead to penile cancer. As well as, other cancers actually. HPV can cause cancers from the oral cavity. This is the mouth and in the throat, as well as the respiration system. And this can also be avoided by the vaccination. Yes. And then with circumcision, it plays a role in reducing the risk of contracting the HPV. It reduces the risk of, if you do get HPV infection, it reduces the risk of it persisting. And it also will reduce the risk of you passing the HPV to the female partner as well. Yes. And then so generally the men who are more at risk are men who are HIV positive, men who have sex with men, and men who have any other diseases that can be reducing their immune system. Yes.
All right. Thank you for that. So this goes to stress the point that the vaccination is not only for the girls, right? It's not only for the girls. So we just want to say we encourage the young boys at primary day to be vaccinated against HPV, right? Because you never know, immunosuppression can come at any time. Then the HPV comes in full throttle. Then, the downstream effects just keep coming on. So thank you so much for sharing that insight on HPV in men. So ladies and gentlemen, we are drawing to the close of this interesting episode where we are learning about cervical cancer. Tatichidzidza kuti HPV ndo virus, ndo utachiwana unokonzeresa kuti cervical cancer inge ichiwanikwa mumuviri. So thank you so much. So Miriam, as we are drawing to a close, what are your final words to our viewers? What are your final words to Zimbabwe, Africa, and the world at large?
Guys, the national anthem, the anthem of the moment is go and get screened. Early detection saves lives. Cervical cancer is curable and it is preventable. Just go and get screened. It's not expensive. It doesn't take much time. It doesn't hurt. Please just do it.
All right. Thank you so much for those words of encouragement. Thank you so much for those words of encouragement. And in closing, I want to say, regardless of any disease you may have and whatever stage you may be at, don't lose your faith. Don't lose your faith, right? As I said earlier on, medicine and faith, they are not mutually exclusive. So we are saying, even as you are getting your treatment, hold on to the faith, right? So, yes, ladies and gentlemen, we're drawing to a close and we have been learning a lot about cervical cancer. However, before we can close, I also want to tell you that Dr. Truth's podcast has introduced our own merchandise. As you're seeing, it's what I'm wearing right here. So please do come through and buy our merchandise. So this is just one of the stuff that we have available. We've got t-shirts, we've got caps, cups, anything that suits your anything that suits you. Tinaishe, we have them. So just come through and order and buy. Support us, ladies and gentlemen, so that we continue to grow. And I just want to say, please don't forget to like, to subscribe, to comment, and to share the link with someone, because we're saying cervical cancer is the topical thing. It is the in thing at the moment, and we want people to be informed. I'm not saying in thing because it could piece out, it's deep and stuff, but it's a concerning thing. And so we want our women, we want our mothers, our girls, our sisters to be, to be safe, to be protected. So whatever it takes to ensure that people are screened, people are vaccinated, let's do that. Ngatite saizvozvo. So Miriam, maybe 3 shout outs before, 3 is there a lot? Before we close.
All right. Well, shout out to my children, Adriel and Anita, my 2 little favorites, mommy's favorite. And I would also like to shout out to my husband, my biggest supporter.
Interesting.
As well as the university. I wouldn't have any of this information if I hadn't come here. Thank you.
All right. Thank you so much. So, ladies and gentlemen, there you have it. We have been discussing cervical cancer here on Dr. Truth's podcast, and I have been discussing this subject with my guest today, Miriam Gunda, 5th-year medical student, University of Zimbabwe. I'm sure you can tell from the quality of responses that have been coming from her. Kuti no, pa University of Zimbabwe, School of Medicine, kune dzidzo iri kuitwa. So if you're out there and aspiring to be a doctor, University of Zimbabwe is also a place to consider, very much a place to consider for your medical school. Otherwise, ladies and gentlemen, it has been an honor and a privilege having you along this journey as we were discussing cervical cancer. And as we say on Dr. Truth's podcast, we keep it fun, we keep it moral, we keep it informative. And we just want to say, continue supporting us, continue sharing the link there at home. Be safe, be hopeful, keep the faith. Until we meet on the next episode, I have been your host, Tinaishe Mhlanga, a.k.a. Dr. Truth. Let's meet on the next episode.